Legislative Committee on Administrative Rules meeting on January 6th, 8 o'clock. And welcome. And I think before we get started, why don't we go around and introduce ourselves, and then we'll get into the agenda. Why don't we start with the senators?
Senator Mark McDonald, usually chair of this, but Representative Squirrel is stepping in for me today, and I appreciate it. I represent Orange County and serve on economics, and I'm on the Finance Committee and Natural Resources Committees.
Good morning, Senator Ginny Lyons. I represent Chittenden County. I chair Health and Welfare and sit on Education.
Senator Benning.
Good morning, everybody. My name is Joe Benning. I am a state senator from the Caledonia District, which is all of Caledonia County and the 6 northeasternmost towns in Orange County.
And good morning. My name is Christopher Bray. I live in Bristol, Vermont. I'm one of the 2 Addison Senate District senators, which covers Addison County, Huntington, and Buell's-Gore.
Good morning, Representative Trevor Squirrel, representing Underhill and Jericho and on House Appropriations.
Good morning, Representative Mark Higley from Lowell. I represent Lowell, J. Westfield, Troy in the town of Eden, and I sit on Government Operations.
Representative Seth Bongartz. I live in Manchester. I represent Arlington, Manchester, Sunderland, and Sandgate in the legislature, and I sit on the House Natural Resources, Fish and Wildlife Committee.
Okay, I'm not seeing Carol with us this morning. I'm just checking here.
No, she's
Back to this remote stuff. Okay, first agenda item are the minutes from December 16th. Do I have a motion to accept?
I'll move that we
So
accept
moved.
the minutes as written from the last meeting.
Okay, any discussion? Okay, just a reminder, we're back on remote. When we vote, we need to indicate our vote and also raise our hand, okay? So all those in favor, please say aye.
Aye.
Those opposed? Okay, we've passed the minutes of December 16th. First item on the agenda is Rule 21P22, Agency of Natural Resources, Vermont Hazardous Waste Management Regulations. At least on my agenda, I have Anna Burakowski. Have I get that right?
Almost. It's Anna Borkowski. Very
Okay,
close.
all right. And I see that Matt Chapman is with us today too. So I don't know if you're just sitting in or you're there to add ammunition to the presentation.
I am here to assist Anna as she needs it. So Matt Chapman, I'm now the director of the Waste Management and Prevention Division.
Okay. All right, Annie, you want to start? Introduce yourself and then we'll listen to your presentation.
Excellent. Thank you. So good morning, everyone. My name is Anna Borkowski, and I am the program manager of the Hazardous Waste Program at the Waste Management and Prevention Division at DEC and the Agency of Natural Resources. Thank you for this opportunity to speak with you about our rule revisions. So I would like to give you a little bit of background on our program and our rules, and then provide you with some specifics on the proposed revisions, and then just give you a little bit of the timeline of where we're at with our rules. So the Vermont DEC has statutory authority for the administration of the hazardous waste program in the state of Vermont, and we are authorized by the US EPA to implement Vermont's program in lieu of the federal hazardous waste program. And Vermont has maintained the hazardous waste management regulations since 1980, and the program has been federally authorized since January 1985. In order to maintain our authorized status and the corresponding federal funding for our program, the Vermont Hazardous Waste Program must periodically update our rules to remain equivalent with the federal Hazardous Waste Program, or the RCRA program, Resource Conservation and Recovery Act. Since we were first authorized in 1985, the state's hazardous waste regulations have been revised 7 times. So the current proposed revisions will be the 8th revision of our hazardous waste rules. Our program has 2 MOUs regarding the management and enforcement relating to 2 hazardous wastes. We hold 1 MOU with the Department of Health, and that is concerning the regulation of mixed wastes, which are hazardous wastes mixed with low-level radioactive wastes. And we also have an MOU with the Agency of Agriculture, Food and Markets, and that is concerning the regulation of waste economic poisons or waste pesticides. None of the proposed rule changes will impact the management of mixed waste, but we did work closely with the staff of the Agency of Agriculture, Food and Markets to revise the pesticide listing to limit its scope. And I'm going to talk a little bit more about that in a little bit. So to provide you with a little bit of specifics on our proposed revisions, the majority of the current proposed revisions are driven either by the required new federal rules, which the program must adopt to maintain a state program that is equivalent to the federal program. So these are new federal rules that are more stringent than previous rules that we're adopting. Or by revisions that are driven by the inclusion of new federal rules that clarify existing hazardous waste requirements. And this is a significant revision to our rules, and we are proposing to adopt 11 new federal rules. So to highlight some of them for you, they include the electronic or e-manifest requirements for the import and export of hazardous wastes, the generator improvement rule, the contaminated wipers rule, the hazardous waste pharmaceutical rule, the aerosol can, and the new universal waste listing amongst the 11 new federal rules that we are proposing to adopt. This revision also addresses several deficiencies and needs that have been identified by the hazardous waste program since the last rule revision. And that includes some technical corrections and the pesticide listing that I mentioned. So to talk a little bit more about the pesticide listing, my program worked closely in consultation with the staff from the Agency of Agriculture, Food and Markets on limiting the applicability of the state pesticide listing, which is known as the VT06 listing, to pesticides covered under the Federal Pesticides Program, or FIFRA. As the current listing exists, the VT06 listing currently captures any waste that qualifies as an economic poison or pesticide. And this currently includes common products such as citronella candles, disinfectant wipes, essential oils that are used as bug repellent, dog, flea, and tick collars. So we have worked to revise the listing to limit the applicability only to restricted use pesticides. And the proposed revision consists of language that was recommended by the Agency of Agriculture, Food and Markets to achieve the intent of what we are describing in the listing. So our draft rule has already been reviewed and pre-approved by the US EPA for program authorization purposes. So to give you a little bit of the timeline on this effort, the program has been working on this revision since 2018, and we have submitted the proposed rule to LCAR on May 26th, and LCAR approved the rule on June 14th, 2021. The proposed rule was submitted to the Secretary of State on June 30th. We held a public hearing on August 10th, and the public comment period was closed on August 27th. And the final proposed rule was filed on November 30th to both Secretary of State and the LCAR committee. After the rule becomes effective in Vermont, the program will also need to seek federal authorization for this rule. And the program is currently working on guidance and training materials for the regulated community. So once the rules are approved and are in effect, we are working to provide a free training resource for the regulated community to make sure that everyone understands the revisions that we are proposing. So that is all I prepared for you today, and I'm happy to answer any questions or if anyone would like to ask them.
Senator Bright.
Good morning, and thank you for the agency for presenting the rule. I do have some more general questions, and I think they originate in two things. One, my lack of understanding of just where the boundaries in different categories of waste lie that are regulated by this rule. So I would, as Mr. Chapman well knows from a lot of time in our committee in the last several years, we've looked at a variety of types of waste. I don't know if they're legally classified as hazardous waste and addressed by this rule. So I'll just run through a few, and then you can tell me that they're in or they're out. So one is landfill leachate, and I'll list them all. And then with depack facilities for food residuals, we're learning more about concerns related to contaminants, particularly microplastics. With the wastewater treatment facilities, we end up with biosolids. And then with economic poisons that are applied, so it could be lawns, farms, fields, they might be appropriately applied, but I don't know if this touches on impacts related to runoff from any of those areas. So yeah, and then PFAS fits in with that leachate category. So I'll just pause there, and maybe that you say, no, we actually address all those things, but elsewhere in law, and this rule doesn't apply to them.
Sure, I think Matt's taking this one.
I was ready to say, so Senator, that is in fact the case. All of these issues are addressed elsewhere through A&R regulatory programs. The issues that you raised are addressed elsewhere in A&R regulatory programs.
Okay, thank you. Just wanted to double check. Thank you.
Any other questions? Senator Bray, did you want to continue? Oh, I'm sorry, Representative Bodie.
Thank you. So this is a question for Matt Chapman. So can you tell us the difference between the regulation and the enforcement, and where you see how you see that working?
So I'm not sure I appreciate your question, Representative. So the rules itself create a sort of comprehensive framework for how we manage things that are classified under state and federal law as hazardous waste. You could probably get a flavor from taking a look at the rule. This is a fairly complicated regulatory structure that deals with the generation, transportation, and ultimate disposal of certain wastes that are classified as hazardous by both the state and federal government. If entities don't follow those sort of strictures that get put in place as far as how they manage things on site or ultimately dispose of them appropriately in the hazardous waste management stream, we have enforcement tools available to us to basically issue either a citation or initiate an enforcement case. I think because this is a federally delegated program, we have a cooperative relationship with EPA, and they also have the ability to enforce and occasionally do inspect and enforce in this area as well.
Thank you.
My apologies for stepping away. I noticed there was a document sent last night. I'm trying to figure out how I can print that or look at that. So anyway, Senator Bray.
Well, I don't want to cut off any further discussion, but I wasn't sure that I saw any other hands. With those clarifications from the agency on some of the more challenging areas of waste that we're continuing to try to address better, then I would there are other venues or other rules, other ways to work on those ongoing problems, then I would move approval of Rule 21P022.
Senator McDonald. You're muted, Senator.
This is a big packet of information, and it's been summarized as being more stringent rules for us to implement from the federal government, and that the rules are being, and there's more flexibility. And I find those, I don't know how you reconcile both of those. And I don't know how you enforce this. My home, we had a dumpster in here this summer, and it was a big dumpster, and we did a lot of cleaning up for the last 15 or 20 years. And it was sort of a policeman as things were arriving at the dumpster to say, don't put this in, or don't put that in, or that's okay, and this is okay. When that container shows up at the landfill, who double checks the best efforts of those of us that filled that dumpster?
So there are actually, so I think it's probably important to sort of draw a line here in how we manage hazardous waste versus solid waste, right? So these are the hazardous waste rules. They're primarily focused on dealing with commercial and industrial generators of hazardous waste, right? So they're not dealing with sort of household generation of things, Senator McDonald, like you identified, in the context of a house clean out or some other thing. So with respect to those specific household issues, they're classified as solid waste and are primarily managed through the solid waste management system. And through that process, there are both free collection opportunities that the state help funds for people to basically segregate those materials from their household waste stream so that they can reinsert them into the proper management system and deal with them. There's education and outreach functions that we work in collaboration with solid waste districts on to make sure that people are educated on what things they shouldn't be throwing in the trash. And then there's basically a joint process that we undertake with solid waste entities, whether that be private entities or public like CSWD or others, to basically inspect certain loads at facilities to try and figure out whether things are being disposed of or not. It is not a 100% foolproof system. It is an effort that the state undertakes to ensure that we remove as much as we possibly can that shouldn't be going into landfills from the solid waste management stream.
Thank you. That's a tall order, and it wasn't, it was household and farm and stuff that's been around for a while, and it was. I don't know whether we did a adequate, or job. We did the best we could, but I don't know who double checks that. But thank you, Mr. Chair.
Okay, we have a motion on the floor, but before we go to that motion, there was a document that was circulated yesterday, and I just brought it up, where the agency had requested to make a couple changes, and I think it's because of communication with Ledge Council. So I'd like either Anna or Matt to just go through that quickly in case people haven't seen that, and then we'll move to the motion. Matt, you're muted.
I was just going to say, Anna, do you want to go through and just walk through the changes quickly?
Excuse me, I was muted. I can certainly do that. My apologies, I'm just making sure I pull up the right memo to go through. Okay. So there were three changes that were proposed based on our correspondence with Legislative Council. The first one was adding the word "or" in between two words, chemical and substance, in 7-103. So the second one was concerning the definition of storage. So we had proposed a definition that was based on the federal definition of storage. And the change we are proposing now is to revert back to the definition of storage that's consistent with the statute, the Vermont statute. So, which was our previous definition, but add a clarifying statement that states storage may be conducted by either generator or designated facility as part of the definition. And the third change is replacing the word "must" with the word "shall" in 7-109B4CI, as was recommended to us by the Legislative Council. So those were the three changes that were summarized in the memo.
Senator Bray.
Thank you for the reminder about the memo. So I'd like to amend my motion, if I could, to approve Rule 21P22 as further proposed by the letter of amendment that we received from the agency on January 5th, as just reviewed by Ms. Borokowski.
Any more discussion? Representative Higley.
Thank you, Mr. Chair. I'm just curious, is this completely recyclable? Just kidding. It must be almost 3 inches.
Okay, any other questions? Okay, we have a motion from Senator Bray to approve Rule 21P22 as amended by correspondence from Agency of Natural Resources of January 5. All those in favor, please say aye.
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 Those opposed? Okay, you've approved the rule. Thank you very much. Thank you, Anna. Thank you, Matt.
Thank you.
Okay, next on our agenda is Rule 21E21. And is Sebastian here? There's Sebastian. I can't see him.
Yes.
There he is. Okay.
Yes, good morning.
Welcome, Sebastian, and introduce yourself and go ahead.
All right, thank you. Good morning. I am Sebastian Arduengo, appearing for the Department of Financial Regulation with respect to Emergency Rule H-2021-02-E, which is for at-home COVID-19 antigen test coverage. So before I get started, I'm just going to ask if you can hear me. Great. So this is an emergency rule that requires health insurers to either reimburse the cost of FDA authorized COVID-19 at-home antigen testing or cover it through the pharmacy benefit. So I'm going to just explain the mechanics of the rule and then go into some of the technical issues that we've faced with implementation, and finally let the committee know about resources we've created to support industry and consumers. So the rule requires health insurers to process eligible claims for retail purchase of antigen test kits that are authorized for emergency use by the Food and Drug Administration. We do this in two ways. First, a member and at this point, members of Blue Cross Blue Shield, MVP Healthcare, and Cigna can do this, can go to a pharmacy and go to the pharmacy counter and get the test kit over the pharmacy counter without paying out of pocket, very similar to how you would pick up a prescription drug. A member can also just purchase a test kit either at retail or online, and then submit a claim for reimbursement. We have limited the coverage to 8 test kits of no more than 2 tests each per covered life per month, meaning that if you have a family of 4, you could have 64 discrete tests covered or 32 test kits. Does that make, I'm going to stop right there and ask if that mechanic makes sense. Great. We've also directed health insurers to reimburse appropriate claims retroactively to December 1st. And the reason we did that was to ensure that folks who bought test kits in anticipation of making their holiday gatherings safe are able to get reimbursed for that. Finally, I wanted to draw the committee's attention to Section 6, which addresses conflict with federal law. Back in December, the Biden administration announced that effective January 15th, the federal government would be issuing guidance requiring all health plans, regardless of whether or not they're regulated by the state or regulated by the feds, for example, Medicare or federal employee plans, to reimburse the cost of COVID-19 at-home test kits. To date, we haven't received any word from the federal government as to what those regulations will entail. But it's our intent that if the federal guidance happens to be more broad than the guidance we've issued, that it would supersede the emergency rule. So now I want to talk about some of the technical issues that have come up with implementing this rule and the steps we've taken to address that. On our website, dfr.vermont.gov, we've created a page about at-home tests that tries to address some of the technical issues. And it is certainly better than it was last month. And I think we could probably break those issues down into 2 groups. I think for the last month or so, the far bigger issue with respect to at-home COVID testing has been supply. I believe that the supply issues have eased somewhat after the holidays, but I think that it continues to be the biggest barrier to access. The second issue with the implementation of our rule has been that typically when insurers cover a new benefit, it comes after months of coding in their claims processing system and then testing to make sure those claims process correctly. In this case, that entire process was compressed into the space of about a week or 2. So there have been all kinds of glitches that have resulted in Vermonters not being able to obtain these tests without paying upfront. We hope that most of these issues have been worked out now, but I think the most serious consumer facing issues at this point are that many of the tests that have been authorized by the FDA don't have a entry in the database that pharmacies use to process pharmacy claims. And this is called the Metaspan database. A lot of them do, but some of them don't. So we encourage consumers to check in with their insurer to see what test kits are processing. Blue Cross Blue Shield of Vermont and MVP both have lists available on their website. And we've included a list of the 4 tests that we absolutely know will process correctly through pharmacy claim systems at the moment. Those include the Binax Now, which is by far the most commonly available COVID-19 at-home test kit, the QuickView at-home COVID-19, the IntelliSwab COVID-19 rapid test, and the On-Go rapid test. I think the last issue with respect to pharmacy processing is that for a claim to process through the pharmacy claim system, it needs to have an ordering provider. So to facilitate that process for both consumers in fully insured commercial health insurance plans and who have Medicaid, which is also implementing a pharmacy coverage benefit for at-home COVID-19 tests. Dr. Levine, the Commissioner of the Department of Health, has issued a standing order prescribing at-home COVID-19 tests to any Vermonter who needs one. That order is linked on the department's website, and pharmacists can use it to put Dr. Levine as the ordering provider for claims purposes. Finally, I just wanted to address a question raised by Legislative Counsel as to why the department did not address other at-home test kits, particularly molecular tests. The reason we did that was to remain consistent with guidance issued by Vermont Medicaid about coverage of at-home tests. And our thinking was that less so now, but particularly in December, there was already a lot of confusion about what was covered and for whom. And by aligning with Medicaid, it was our hope that we could lessen some of that confusion for consumers. One thing about those molecular at-home tests that I did want to flag for the committee is that under the federal guidance that was released last year with the Families First Coronavirus Relief Act, at-home test kits are supposed to be covered without member cost sharing if ordered by a physician based on the individual clinical circumstances of a patient. So if your PCP prescribes a COVID test and you pick one up, that should process without member cost sharing, even if you're not getting one of the antigen tests. Okay, I'm going to stop there, and I'm happy to answer any questions.
Representative Hinckley.
Yeah, thank you, Sebastian. The question I've got is, what is the average cost of one of these test kits, and does it vary across the board with the number of test kits that you listed?
Yes, so test kits range from between $15 and $40. They most commonly come in packs of 2, but at some retailers, and particularly online, you can buy them in greater quantity. At some retailers, you can get a bulk discount for buying in quantity, but with the current supply constraints, at most places, consumers won't see a bulk discount. So if a test kit is $20 and you buy 5 of them, you'll have to pay $100. One thing that I wanted to flag for the committee in that respect is that with respect to online bulk purchases, we've advised insurers that it's not our intent for insurers to reimburse consumers for bulk purchases, since it's unlikely that those tests are for use in a home setting. So for example, if a consumer buys 30 test kits, they might need that for their business or for some other purpose, but it seemed unlikely to us that that was for home use, which is what this emergency rule is intended to cover.
Thank you, Sebastian. That puts it in a little bit better perspective for me. Again, if you're looking at the $40 test kits and somebody was to get 32 of them, you're talking over $1,200. So
Yes.
It could become substantial if it continues.
Other questions? Okay. What action does the committee want to take? Representative
The quickest-
Senator Lyons? Senator
I
Lyons?
just have a quick question. Is I heard the 4 types of tests: Binax Now, Quick View, at home, COVID-19, the on-go rapid test, and what was the third one that you listed?
The third one is the IntelliSwab COVID-19 rapid test.
Thank you.
And the entire list is on our website, along with frequently asked questions for consumers and the guidance and clarifying information for insurance companies. So we've just made all of that information available to the public.
Senator McDonald.
What is your website?
Yes, our website is dfr.vermont.gov. And there's a prominent link to our at-home COVID testing guidance right on our homepage.
So families who might be listening this morning that have questions about self-testing can go to that website and get them answered with some assurity that they would be likely reimbursed.
Yes.
Is the department able to find a way to get that website out to the vast majority of folks who are not listening to this discussion this morning?
We have publicized it, and we've also worked with our partners in industry, particularly with Blue Cross Blue Shield of Vermont and MVP, to develop consumer guidance that's available both online and through other outlets as well. And I think that I'd be remiss if I didn't publicly thank everyone at Blue Cross Blue Shield of Vermont, MVP, and Cigna, who's worked to implement this benefit and make it available to consumers and provide that consumer guidance on what I think has been the most compressed timeline that we've worked on since the beginning of the pandemic.
Thank you, Mr. Chair. It seems that much hard work has been done to do exactly what the witness just described, and to the extent that Vermonters can learn that house by house sooner rather than later, we will all benefit. Thank you.
Senator Lyons.
I'd like to move the approval of 2102 emergency rule from DFR regarding antigen test kits.
Okay, we have a motion to approve Rule 21E21, at-home COVID-19 antigen test coverage. Any more discussion? Okay, all those in favor, please say aye.
Aye.
Those opposed? Okay, you have approved Rule 21E21. Thanks, Sebastian.
Thank you.
Next on the agenda is committee discussion regarding a memo regarding Green Mountain Care Board's data rules regarding subcontracting and the preservation of data. Ledge Counsel Anthea had circulated that memo, but I'll turn this over to Anthea if you just want to run through that, and we can have a discussion from there.
Certainly. So for the record, Anthea Dexter Cooper from the Office of Legislative Counsel. The memo is also posted. It addresses the two concerns that the committee discussed at your last meeting of 2021 regarding subcontracting and data preservation with the Green Mountain Care Board data rules, the two rules that you approved at your last meeting. You also have some information that we've compiled in addition to information we received from the Green Mountain Care Board regarding current contractual language and the fact that the contract does say that there needs to be written approval from the state in order to subcontract, and the actual written authorization for the existing subcontract that they have for one of their contracts, along with links to boilerplate provisions that go in state contracts. So you've got more information than you did at your last meeting, and then you have the draft memo to approve or change. It would go to the chairs of the subject matter committees in the House and the Senate, Senate Health and Welfare, and House Healthcare.
Any questions for Anthea? Any discussion? Anthea, does this require a vote?
Yes, it does.
Okay. So what does the committee want to do? Is there a motion?
So moved.
Okay, there's a motion on the floor to approve the memo of January 6, 2022 related to concerns related to the Green Mountain Care Board data submission rule 8 and Green Mountain Care Board data release rule 9. Any additional discussion? Okay, all those in favor, please say aye.
Aye.
Aye. Those opposed? Okay, you've approved sending the memo to the committees of jurisdiction. Is there any other new business? Okay, just a comment. We'll have a meeting next week which will also be remote based on the resolutions of the Senate and the House. And then after that, I guess we'll see whether we'll be in person. I think there's still a question about where that meeting might be held. Charlene, do you have any additional information?
Well, you still need to approve the in-session meeting schedule that,
Okay, all right, okay. But and do you have any more information about a possible room?
the only thing that I know is that Senate Finance is not going to work
Okay,
because they're in there a lot. Senate Appropriations is, I think we might be able to use that room because they don't use it in the morning. So I will, I'll let you know when I hear back.
okay, great. Well, thank you very much.
Mhm.
Okay, so we have one more item. The schedule for the rest of the year for LCAR meetings was distributed to everyone. So can I have a motion to approve that schedule? Representative Odie? Is that a yes?
Sorry, so
I
moved.
can't hear you, Representative Odie.
Sorry, so
Okay.
moved.
All right, thank you. All those in favor, please say aye.
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 Aye. Those opposed? Okay, you've approved the schedule for LCAR for 2022. Any other new business? Seeing none, motion to adjourn. Senator McDonald.
Yeah, thank you, Senator, Representative Squirrel, for filling in today. You were flawless. Thank you.
My pleasure. Okay, do I have a motion to adjourn?
So moved.
Thank you. Okay, all those in favor, please say aye.
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 Anyone opposed? Okay, thank you. Have a great day.